Hi, I'm Jen. I'm a second year student midwife at the University of Manchester, and I'm here today to talk to you about some of the challenges that you may come across during the early days of your breastfeeding journey. So, some babies can be what you might hear described as slow starters when it comes to feeding. Babies may be slow to feed for several reasons, and it's perfectly normal for some babies to feed infrequently in the first few days. It's important to encourage your baby to nuzzle and to suckle at the breast in the early days, as this really helps to increase milk supply and to establish breastfeeding. You can help baby to nuzzle and suckle at the breast during skin to skin, and this helps to switch on those milk producing cells and baby to become familiar with the breasts. Hand expression of colostrum can help to entice baby to the breast if it's dripped into their mouth. And also, how well a baby feeds initially can depend on the type of birth and pain relief used during labour. So often, all it takes is some gentle handling and patience, and you can overcome some of these challenges quite easily. Sore nipples can hugely impact on your breastfeeding journey. So usually this happens if a baby isn't positioned or attached well at the breast. So if a baby sucks just on the nipple rather than the whole areola, this can cause their tongue or the roof of their mouth to rub on the nipple, causing the nipple to become very sore very quickly, and can cause the nipple to become cracked. It's important to remember breastfeeding shouldn't be painful, so important to get breastfeeding support right from the beginning of your breastfeeding journey. It's important to remember sore nipples won't get better unless a position and the latch of your baby is improved. Also, a baby that refuses the breast can be really distressing for both mum and baby. So this behaviour doesn't mean that your baby dislikes your milk. It can be down to a baby struggling to latch effectively and your baby becoming just frustrated. It's important to seek support and to check position and attachment. A change of position or just skin to skin can really help. And again, really important to remember, relax. So when you're relaxed, your baby's relaxed. On the flip side, frequent feeding can also become a challenge for mums. Babies often cluster feed, meaning the frequency of breastfeeds increases. This can be really tiring and really demanding, but be reassured it's completely normal and it's a normal process that babies go through to increase milk production. So it's important to be flexible and adaptable to your baby's demands. So responsive feeding enables babies to receive what they want and what they need at a time that they need it. And it's much more than just food. So it's about love and about protection, about their comfort, about their rest, and also the relationship building between you and baby. So some of the most common reasons for newborns to refuse the breast can be things like a difficult labour or delivery. So your baby could be sore, could have a headache. Medication used during labour. So for example, pethidine could cause a baby to be a little bit sleepy or a little bit groggy when they're born. Babies being separated from you, even just for a few minutes, can affect a baby's initial feeding. Discomfort due to a birth injury, so for example bruising during birth. Babies often swallow mucus during birth, and this can make them feel a bit congested or a little bit uncomfortable. An early unpleasant experience, for example, being forced onto the breast can leave an effect on baby and cause initial challenges. So it's really important to seek support and advice right at the beginning of your breastfeeding journey. So please look at our website for more information about breastfeeding and breastfeeding support. Ask your midwife. She'll be more than happy to answer any questions or discuss any questions you may have. There's some national websites and helplines that you can access. So, for example, the Association of Breastfeeding Mothers, we have the Breastfeeding Network, we have Laish League, and also the National Childbirth Trust, all great resources for you to access during your breastfeeding journey.